Good morning. It's Tawni Peterson, nurse practitioner from Adams County Health Center. This morning I'm going to do a live feed on medications that are being tried in the treatment of COVID-19. Down below I'm going to provide a link for a website that you can access through ASHP, Pharmacists Advancing Healthcare. It's a great document because they talk about the different medications that have been studied and what the studies revealed. It's very user-friendly, and I found it to be real interesting. There are a few medications right now that are being talked about on social media, in the news. We're getting a lot of questions at our clinic and at the pharmacy. It's hydrochloroquine, chloroquine, and azithromycin, either used alone or used in combination. People are wondering, should I be asking for a prescription for these for preventative use? What if I come down with COVID? Can I get a prescription for these? So that document is quite fascinating if you feel like accessing it. And really what it's showing is that these medications are and have been used in the hospital setting and in different countries even. And I will say there are certain studies that are showing some benefit to these medications. But the big picture is that it's just too early. The studies are limited, the study sizes are limited, and they can't come out with the fact saying that there is true benefit behind these medications yet. And you also have to keep in mind that these medications might be used in different stages of the disease, and are there patients that are truly candidates for these medications, and how long should they be used? What dosages should they be used? Should they be used in combination? It's just so early on that we just have to stay tuned and see what these studies end up revealing. If you access that document, you can find medications that might interest you. Another one that I was interested in was ascorbic acid, just because I, like many of you, have seen on social media, they used X medication and got these amazing results. And so I did see one that they were saying that they were using ascorbic acid in high dosages IV. And so when I came across that in that document, I'm like, I want to see what study that was and what the findings were. And again, it was just inconclusive because there's just not enough information available. But the one that I did find very interesting, just because many people do use this, is nebulized treatments for just different respiratory conditions. And what they're saying, and this is really important information, is that if you use a nebulizer, you know how it sprays the mist into the environment. So you want to be careful with those. You definitely don't want to stop using your nebulizer. But if you are infected with COVID, or there's a chance that you have been infected, make certain that you use your nebulizer in an area that mist wouldn't spray into the environment and possibly infect somebody near you. So use your nebulizer outside, or use it on your patio, use it on your deck, use it in your garage. And when you're done using it, then wipe the surfaces down. You just want to prevent infecting others. In the hospital setting, they're actually using the metered dose inhalers in place of the nebulizers so that they can contain that spray. Another good one is NSAIDs. There is so much information right now floating around on social media, like do not take ibuprofen and do not take your NSAIDs. And that is really important to address because there is some truth to that. If you read studies that have been done in the past, NSAID use with other viruses, not COVID, they actually have found that NSAIDs can weaken the immune system and can interfere with a person developing immunity. Keeping in mind that is not studied with COVID. But it's reason enough to believe that maybe we should be cautious with it. The CDC and the FDA are saying that at this point, it is safe to take your NSAIDs. I do like what the FDA says, and that is, if you're taking NSAIDs for chronic pain, then don't stop taking your NSAIDs, because then we have a whole nother problem. But my personal belief is if you don't need to take an NSAID, just don't take it. Don't take it until we actually have more definite answers. The last time I did a live feed, we talked about truths and myths, and I kind of think this is the most fun part, just because I'm shocked sometimes at some of the things that people do and some of the things people believe. So, chloroquine. Chloroquine is a medication right now that they are using in the hospital setting to see if there's any benefit. But the problem is that people are purchasing chloroquine phosphate off the internet over the counter, and this product is found in aquarium chemicals. And they don't know if people are stockpiling this chemical in case they contract COVID, or if they're using it for prevention. But it's extremely dangerous. Like, do not ever do that. They do have one documented death from someone that took the over-the-counter chemical, aquarium chemical, and they have one documented hospitalization with severe GI disturbances, stomach upset. The bottom line is just, my goodness, don't order that aquarium chemical, and definitely don't take it. I mean, order it if you're using it for your aquarium, but absolutely do not take it for COVID. So some takeaways from today's live presentation is, at this time, there are no pharmaceutical medications that are FDA approved for the prevention or treatment of COVID-19. Do not ingest aquarium use or any other chemicals that contain chloroquine phosphate. These chemicals can lead to serious health consequences, even death. If you request hydroxychloroquine or azithromycin from your provider, it's going to be a little bit difficult to get it unless you're using that for a diagnosis that has been approved for the use of these medications. When we write this prescription, we now have to put the diagnosis on the prescription, and the diagnosis has to match what the medication is supposed to be used for, the amount of time, and there are no refills allowed. They are finding that people that need these medications for approved diagnoses are running short, and if they find that they are a benefit in the hospital setting for COVID, we also don't want to create a shortage there. The other thing is, if your friends happen to have some of these medications because they have a diagnosis that fits, please don't take your friends' prescriptions. Remember that medications are very powerful, and not everybody is a candidate for these medications. So if you have kidney or liver concerns, cardiac/heart concerns, you would never want to just go take these medications, because the results could lead to seizure, coma, or even death. Let's see here. I think that's all I have for you today. Do keep in mind that Adams County Health Center does remain open. You can see our hours of operation on our website, achc.org. Our pharmacy has a really great new software, so when you order your prescription, you'll get a text message and you can pick it up curbside. We are treating through telehealth as well as at the clinic, but if you want to adhere to the social distancing and stay in the safety of your own home, we can conduct your medical appointment via internet or over the telephone. So call us at 208-253-4242. On Thursday, I'm wrangling Rio to get back online with me, and we're going to discuss why COVID testing is so important. So that's it for Monday. Thank you guys, and have a great day.